Did insurance coverage for telehealth rules change in 2025? Breaking news for patients and healthcare providers. The question on many minds today is whether insurance coverage for telehealth changed in 2025. If you are curious about how these changes might affect your healthcare access, you are in the right place. Let's get into the details that matter most to you. Yes, there were notable changes to insurance coverage rules for telehealth in 2025, especially for Medicare and related programs. Starting October 1, 2025, Medicare will largely revert to its pre-pandemic telehealth rules. This means that for most telehealth services under Original Medicare, patients will need to be located at an approved medical site in a rural area to receive telehealth coverage. The temporary expansion during the COVID-19 pandemic that allowed beneficiaries to access telehealth from their homes will end for many services. However, some exceptions remain. Coverage for mental health counseling, substance use disorder treatments, dialysis visits, and a few other services will still be reimbursed when provided at home, regardless of the patient's location. Medicare Advantage Plans may offer additional telehealth benefits beyond Original Medicare. Patients should check with their providers and insurance agents to understand their options and plan accordingly. For opioid treatment programs, there were updates allowing more telehealth flexibility. Providers can conduct periodic patient assessments via audio-only telehealth when video is unavailable. Initial methadone treatment intake can be done via two-way video if in-person evaluation is not feasible. These changes aim to improve access to care for patients in remote or resource-limited settings. Additionally, new billing codes and expanded medication options for opioid use disorder treatment were introduced, reflecting broader telehealth service, coverage, and reimbursement enhancements. Providers should also be aware of updated current procedural terminology codes for telehealth services and site-hub service requirements to ensure proper documentation and billing. The Centers for Medicare and Medicaid Services continues to adjust policies to balance telehealth access with cost control, including a shift toward value-based care models. From the perspective of doctor visits, telehealth continues to offer convenience, flexibility, and access to specialists, especially for mental health teletherapy and remote patient monitoring. However, with the 2025 changes, patients and providers need to verify coverage specifics and how to set up telehealth appointments under the revised rules to avoid unexpected costs or service limitations. While telehealth remains a useful option, 2025 brought a partial rollback of pandemic-era coverage expansions. Staying informed through providers and insurance agents is advisable to navigate these changes effectively.